Good afternoon, I'm Andrea Albers. We are interrupting ABC programming to bring you live coverage of a press conference getting underway in Madison. Right now, Governor Tony Evers is set to give an update on the efforts to stop the spread of COVID-19 in Wisconsin. Let's listen in.
Orders still in effect across our country. You've likely heard me talk about reopening our economy, and I've said all along that it needs to be more like turning a dial than flipping a switch. No one wants to open our economy as much as I do, and we're working to do everything we can to make sure we can do so as soon as we safely and responsibly can. And that's why today we're announcing a new order that, coupled with our Safer at Home order that went into effect last week, turns the dial a notch by allowing non-essential businesses to do more than they were able to do before. Under our original Safer at Home order, non-essential businesses were only able to do things like process payroll and employee benefits or preserve inventory or equipment. So there are some big changes in that order that went into effect last week and the order we announced today. So I want to spend a bit of time just talking about what our new Safer at Home order means for families and small businesses across our state. That means every business across our state can do things like deliveries, mailings, curbside pickup, and curbside drop-off. So for example, whether you're an upholsterer, a taxidermist, a dog groomer, or you rent recreational equipment like kayaks, paddle boats, or canoes, you'll be able to provide some of those services under our new order. Now, we still need folks to do this safely. So if you're in a business who wants to start doing deliveries, mailings, curbside pickup, or drop-off, we still need you to help us make sure that our workers and folks across our state can stay safe while supporting our local businesses. That means we still want those operations to be able to be performed by one staff person in a confined space. Services must be paid for online or by phone, and customers can't be inside the business or facility. This is an important step in making sure that while folks are staying safer at home, they can also continue to support small businesses across our state. If you have additional questions on how to make sure you're taking the necessary steps to keep your workers, business, and customers safe, please visit wedc.org. While we're turning the dial a notch on what some of our businesses can do, we're not out of the clear just yet on Safer at Home. Secretary Palm will give an update on today's COVID-19 cases in Wisconsin in just a few minutes. But over the past few days, we've seen some concerning numbers, including the largest single-day increase in positive cases since the COVID-19 outbreak started. In particular, and I know some folks asked about this last week, we are working hard to address the increases in Brown County. Our folks have been working around the clock to address the rise in cases in Brown County, and I've spoken to County Executive Troy Streckenbach to offer state support to bolster their testing and contact tracing efforts in the area. But what we're seeing in Brown County and others in our state underscores the importance of taking a statewide approach to Safer at Home right now. I know folks have asked about reopening rural communities sooner and taking a more piecemeal approach, and I hear those concerns. Here's the deal though, an outbreak in a rural area where access to healthcare is already limited and healthcare resources are scarce could have the potential to severely overwhelm local governments and local healthcare workers. We don't want that to happen. That's why we continue to monitor the data and why, for now, we are continuing to ask everybody to stay safer at home. Working to flatten the curve is critically important. It's also why we're taking a phased approach with our Badger Bounce Back Plan, which provides benchmarks for our state so that we have a better idea who's sick and who's not, where the disease is progressing and where it's abating, and what medical resources are available in each community. It's a data-driven approach to keeping people safe. There have been a lot of questions about setting a date for when more businesses will reopen. Again, the good news is that, especially compared to some of our neighboring states, Wisconsin has a significant number of businesses that have reopened, and many more that never closed in the first place. There are tens of thousands of people working every day around the state. We know that people continue to do essential activities like grocery shopping and picking up medicine. We've opened up activities like golf, expanded curbside pickup for many retailers, and continue to evaluate ways that businesses can operate safely. I've had many discussions with business owners and business leaders across the state, as well as many working folks, and we will keep those conversations going as we continue to turn the dial. We have to be patient, and I know that this is tough on workers and businesses and consumers alike. Everyone depends on a thriving economy, but I have faith in Wisconsinites, and I know we will get there if we continue to flatten the curve and we continue to develop testing, contact tracing, and PPE components that we need. We will start on the road back. And now I'll hand it over to Secretary Designee Andrea Palm.
Good afternoon, everyone, and thanks for joining us again today. Last Friday, we launched a new data dashboard on the DHS Badger Bounce Back website as part of our commitment to transparency during this pandemic. While we work to turn the dial and phase our state open, we know we are asking you all to make significant sacrifices. We have an obligation to share our decision-making process with you, and that means sharing not only our criteria for a phased reopening of the state and our plan to get there, but it also means sharing our progress on those criteria and that plan. We want you to know where we're going, how we're going to get there, and where we are in our progress along the way. The data dashboard currently focuses on the Wisconsin gating criteria, taken from federal guidelines on what a state needs to accomplish to reopen safely. The criteria include standards to meet concerning symptoms, cases, and hospital capacity. DHS and key stakeholders from our healthcare systems are developing the methods to measure hospital capacity. However, the symptoms and cases metrics are up on our website already. The gating criteria require a downward trajectory in symptoms of both influenza and COVID-19, as well as a downward trajectory in positive tests as a percentage of total tests. Graphs on the website detail this data more completely, but I can summarize it here for you today. Based on data tracking emergency room visits for flu and COVID-19 symptoms, we see a slight downward trend, but one that is not statistically significant. Our positive cases continue to rise. The data dashboard displays this information as a percentage of positive cases out of the total number of tests, which currently is showing an upward trajectory. This is a good time to share our daily numbers with you more broadly, as we do every day. We have 48 active labs running COVID-19 tests in Wisconsin, with a daily lab capacity of almost 11,000 tests. We have 61,311 negative tests, which is an increase of 2,076 over yesterday. There are now 6,081 confirmed cases of COVID-19 in Wisconsin, an increase of 170 over the total yesterday. Our deaths have now reached 281, and we have one county reporting a death for the first time. That's Manitowoc County. These numbers are why we need to commit to Badger Bounce Back, because Badger Bounce Back will make it possible to achieve the Wisconsin gating criteria. Rapidly and dramatically increasing our testing capacity and recruiting enough contact tracers to follow up on positive tests will give us the tools we need to contain this virus. Testing will show us the spread of the virus, and tracing will enable us to help individuals who test positive for COVID-19 to quarantine and to stop continued spread. We are aiming for 12,000 tests a day, or 85,000 tests a week, and to hire 1,000 contact tracers. Just like our commitment to reporting our progress toward meeting the gating criteria, we will also report on the progress we make toward these goals, and that is because we can't bounce back on our own. Badger Bounce Back is a community effort, and that is why we want you to have this information on our progress, because it's your progress too. And as we make progress together, we will continue to turn the dial. Thank you for your continued partnership in this effort.
And thank you. We'll now open it for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please one question per reporter per media outlet. And we'll begin today with Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking my question. I do have to ask it in two parts. What kind of instructions has DHS given to local jurisdictions about assessing the deaths of people who have not been tested when they were alive, and what are those instructions? And the second part is, what is the current thinking about what % of the population not tested might be infected, and are there plans to further expand testing to identify non-symptomatic cases? Thank you.
Yeah, this is Ryan Westergaard. I can take those questions. The first one is about reporting and understanding deaths from COVID-19 of people who weren't tested while they were ill. And early in the response, we worked with CDC and developed guidance for medical examiners and through mortuary affairs to identify best practices for testing of people who have died, and those guidance documents have been disseminated, and there's clear mechanisms for being able to do that, and some infection control guidance as well. So that is something that can happen, and those are decisions that are made at the local level. Regarding the understanding the epidemic in the absence of comprehensive testing, there's a few strategies that we're trying to do to understand the true number of infections. One, as the Secretary and the Governor alluded to, is just to increase the testing as much as possible in healthcare settings, and that includes lowering the threshold for testing people who develop symptoms and having a greater coverage of people who are symptomatic in healthcare settings. We've also started to test asymptomatic people as part of specific outbreak investigations. So when we identify one or more cases in a high priority area like a skilled nursing facility, a nursing home, a jail, or other environment where people are in close quarters, we'll increasingly do a testing strategy that involves a sort of a blanket approach to testing a large number of people. And the third thing that we're working on in the future is using different kinds of tests, including antibody tests on a population level as a surveillance activity to understand the number of people who have been infected and not previously reported to care and tested in healthcare settings. A number of states have done that. New York State recently published a paper using a similar strategy, and we're looking into being able to do that in Wisconsin.
Thank you, Eric. Now to Mark Leland from WLUK in Green Bay. Mark?
Yeah, thank you very much. I wanted to focus on Brown County. Obviously, you indicate it's one of the hot spots in the state. What exactly is the state doing to assist in Brown County? And specifically also, you're talking about conducting more tests. You'd like to see 12,000 tests a day. Are you increasing the testing up here to kind of trace where it is spreading up here and what it is happening in Brown County?
So I can, Mark, I can dig into some of the specifics around that, certainly. So we have been in close contact with Brown County over the past week or so. And initially, we surged 2,200 test kits into the county in partnership with Bellin Health and some of the workplaces there to do specifically testing of the workforce on site at those facilities. Over the past several days, over this weekend particularly, we have been in development in partnership with the county emergency management, county public health, the health systems in the region, local electeds. The governor mentioned talking to the county executive there over the weekend to develop a plan that will not only continue to test workers at these facilities, but will expand to include household and family members, as well as a strategy to test in the community more broadly. That work starts today. We have surged an additional 2,500 tests into the county to get that work started. And National Guard will be standing up a number of testing site teams to surge into the county to wrap around the work that is already going there, again, to make sure we are continuing to test workers, expanding to family and household members, and then to the community more broadly. So that is scaling up today over the next several days, and we are on track to continue in addition to the first 2,200 tests, the 2,500 additional tests to surge tests on a weekly basis into that outbreak until we get our arms fully wrapped around it. We've also surged contact tracing resources. As you know, we have been developing and building up that workforce over the last month, and as part of our goal to get to 1,000 contact tracers, Brown County has requested our assistance with contact tracing, which we have done. Specifically, they have referred 196 positive cases to our surge contact tracing team to do the follow-up on. So we have wanted to be and have been able to be helpful in the contact tracing piece of this as well.
Thank you, Mark. Now to Scott Bauer from Associated Press. Scott?
Hi, thanks again for doing the call. Governor, can you explain why this turning of the dial, as you say, is happening today, given that we're not seeing the trajectory yet in the right direction on these cases? What has changed to warrant this loosening at this point?
Well, as I've said all along, we keep an eye on the data and the science involved, and we believe that these activities that we talked about are kind of one-off issues where it's a single person, a single consumer interacting with a single provider of services. Say it's somebody that's renting a kayak. And it seems that we are able to do this in a way that's safe, and the things that we've laid out are very clear. That has to happen outside the business. It has, clearly the social distancing has to be there, and so there are enough control factors involved that we believe it's a safe expansion going forward.
Thank you, Scott. Now to Shemaine Mills from Wisconsin Public Radio. Shemaine?
Hi, this is Miranda Suarez filling in for Shemaine. I was wondering, going back to the Brown County outbreaks in the meatpacking plants, we received some questions for listeners who are wondering if it's safe to eat the meat that might have been processed or packaged in plants where there is an outbreak. So I'm wondering if you could talk to me a little bit about that, if it is safe to consume food from those places.
Ryan Westergaard here. I can explain the best that we know is that there hasn't been described cases of transmitted virus from eating contaminated food. It's never possible to prove something is impossible, but what we know about coronavirus and respiratory viruses in general is that they cause infection by coming in contact with respiratory cells in the nose, eyes, throat, and through inhaling. So ingesting contaminated food is not a common way for infection to cause in any respiratory virus, so it's not thought to be a great concern right now, but certainly it is always appropriate to proceed with caution.
Thank you, Miranda. Now to Victor from CBS 58 in Milwaukee. Victor? CBS 58?
Hi, good afternoon. Thank you again for taking the call. Can you hear me?
Yep.
Yep. Okay. Just wanted to kind of bounce off of the Scott Bauer question about, the criteria for this specific order that was announced today. I guess, if you could kind of expand on, if you see a timeline of what other activities or business operations do you see could be the next step?
Yeah.
Not necessarily a timeline of that, but I guess what could be, what are those, the next step you would see?
Yeah, and that's a good question. It's one that we've talked about frankly all along, is that as we have expansions, whether they're major or minor, and I'm guessing this fits into the latter category, we have an opportunity to observe that how it's working, have people report where it's not working, and we can maybe come up with some more frameworks to guide that financial interaction between a customer and a business owner, and also look at the data as it looks across the state. The previous question from AP was dealt with that issue. We've had some surges, absolutely, but if you look at it as compared to the number of tests, the trend line is up, but it's not like shooting out of the roof. It's marginally up. And so we'll continue to watch that, but we take these steps so that we can learn from them, so that the next opportunity that presents itself, we're doing it knowing how this worked. And that's why it's real important to reinforce that slow, methodical work around reopening the business world has to be methodical and slow, so that we can observe how it works and what we've learned from that to going forward.
Thank you, Victor. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell? The Wisconsin State Journal.
Yep, sorry about that. Thank you very much for the call today. I was just kind of bouncing a little bit off that, and I know that we don't want to, lock into a specific day as far as when we might get to that first phase of the Badger Bounce Back plan. But I was wondering if you might be able to talk just a little bit more on kind of as testing increases, do we have any sort of an indication on kind of, when we may be seeing kind of that more widespread opening that a lot of people have been calling for?
Yeah, and I'll do it quickly, and Secretary Palm can add to it, or Dr. Westergaard. But we set criteria out there, and it's around those three things that are mentioned. And if the trend lines do head downward in a significant way, then that speeds up the process. If it's stable, that gives us some pause, but there may be some other opportunities we can look at. So it's also, it's following the data, following what's going on. We anticipate that with more testing and more more tracing going on, that we will get in that position so that we can make even larger decisions around larger changes. But we have to see that data going forward. And I just have to go back to a previous question. It's also real important for us today to talk about what good business practices are. We have a lot of essential businesses out there that right now that are serving the public, and we just wanted to remind them of the importance of social distancing in your stores. There are times when people drive by a large store and the parking lot is full, and that there's hundreds and hundreds of people within that store. The question should be asked, is there social distancing going on? So this also gives us an opportunity to remind those that have been essential businesses, especially in the retail world, prior to this or since the beginning of this pandemic, that we must insist that those social distancing, those good business practices are still going on. That is critically important for us.
I guess I would add on the testing capacity specifically, as we drive towards this goal of 85,000 tests a week, when you look at what that means on a per capita basis around the state, there is no place in the state that is reaching the kind of capacity that is necessary at the community level for us to feel like we've got enough data to understand the prevalence in those communities. And so our strategy around testing, in addition to what Dr. Westergaard talked earlier about, specific outbreak testing, working with our health system partners to stand up more access to testing through those settings. There also is a critical component of this that is making sure that outside of those traditional settings that there is access to testing for those who have symptoms, so that we are increasing the rates of testing across the state, commensurate with the goals we're setting around our testing capacity and access to tests more broadly. That is the way we're going to understand this disease. It is the way we are going to stop the spread in conjunction with, as the governor said, the contact tracing, so that we are really containing it in a way that is aggressive, and that is the only tool we have until we have a vaccine or medical intervention. So we're tracking closely our capacity as it relates to its how it tracks across the population around the state, so that we are rising all boats, and that access to tests are increasing all over this state.
Thank you, Mitchell. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey.
Hi, thanks for taking the call. Governor Evers, in your opening statement, you mentioned dog groomers among the non-essential businesses that'll start being able to do some kind of services. And actually, this morning in Oshkosh, a dog grooming business, the owner was taken into custody and is facing charges for not complying with the order. What's going to happen to people that are facing charges or are facing fines or warnings and things like that for not complying with the order, but are now able to? And I mean, it's a several-hour difference here between when she was told she's going to be facing charges and now that she could be doing these curbside services.
Sure. This is Ryan Elsistu, and I'd be happy to answer that question for the governor. So with all enforcement of whether it's the safer at home order or this turning the dial order, it's up to local officials to enforce it, and it'll be up to local officials in order to make a decision. When somebody is arrested or ticketed, then it's up to the local district attorney to exercise their prosecutorial discretion on whether or not to enforce that. And so it'll be up to the DA to decide on whether or not to move forward or take a look at the fact that, soon dog groomers across the state will be allowed to open, and they'll have to make that decision on it. But I do think it's one of the things that is worth pointing out with all this is, overwhelmingly we're seeing a lot of folks across the state that are in full compliance, and that's really what we're relying on, is people acting in good faith to be able to make the right and smart decision in order to protect both their health, their workers' health, and also their customers' health.
Thank you, Casey. Now to Amy Reed from WISC in Madison. Amy, sorry. WISC. Okay, we'll move on then.
Can you hear me?
Now we can, yes. Go ahead.
Sorry, I hit #6 instead of *6, so that won't work. So I'm looking at that data on the DHS site. The positive percentage is bouncing, it looks like, between 8 and 11% over the last few weeks. What changes do we need to see, whether that's coming from DHS or from the community, to move that percentage down? And also, some have said that increased testing and expanded criteria will lead to increased positive tests and keep the order extended. Does anyone there have a response to that?
Sure. On the last point, increasing testing could potentially lead to increased numbers of cases. It would not necessarily lead to an increasing proportion of tests that are positive. So the parameter that we're tracking is the percent of tests that are positive over time. So in order for the rapid scale-up of testing to not result in that, we really need to see a decrease in community transmission. So both things need to be at work. We do want testing to scale up, but right now we're in a situation where there is community spread, probably in too many communities to feel like we would confidently be able to do those containment activities like highly effective contact tracing and quarantine for people who've been exposed. So we do want to see the total number of cases go down as well as a percent, but the using the percent as the parameter that we're following, the trend is a little bit more stable to changes in variable of how frequently we're doing testing. So that's why that parameter was chosen. But both things are important: the number of tests overall, but also the true prevalence, which we get by determining positive tests.
Thank you, Amy. Now to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick?
Hi, thanks for taking the question here. I wanted to ask about this 14-day downward trajectory. Does that mean that each of those 14 days you must see a reduction, or do you look at a 14-day segment and find a reduction over that entire period? In other words, it can sort of go up and down during those days if its general direction is down. And also, when are we going to see the hospital data on the dashboard?
So I'll let Dr. Westergaard dig into the details, but broadly, Patrick, it is a 14-day rolling trajectory, and as Dr. Westergaard talked about, the goal there is to smooth out bumps in the data, using the trend, using regression to help us see the data in a way that isn't as sensitive to fluctuations in daily ups and downs. And so we tried to, consistent with the federal guidelines, or the same as the federal guidelines, have a 14-day trajectory that would allow us to see this trend in a way that wouldn't that is smoother. Well, Dr. Westergaard can probably say more science-y things about that, but I'm trying to be more plain language about it. So it is a rolling 14-day trajectory where we're attempting to smooth out the bumps.
No, I think that was a great description. Anything we measure in science has noise or has some error. So we measure any parameter that's going to go up a little bit and down a little bit. And as we've talked about all along, we're not measuring the true number of cases. We're measuring the subset of people who are tested. So that, and the fact that like the previous question alluded to, we are doing some focused increased testing where we may go to an outbreak situation and test 200 people in a day. So the numbers of people who test positive in a certain community might be high in one layer. So the method is something that we do in statistics all the time, is sort of doing a trend line or a regression to say that on average, is there a significant downward trajectory, understanding there might be blips up or down from day to day.
And as to the hospital capacity gating metric, Patrick, we have had two conversations with our hospital partners and are working on that actively right now, with the goal of being able to add that to the dashboard as soon as we absolutely can.
Thank you, Patrick. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben.
I'll pass. My question was answered. Thank you.
Okay, thank you. To Mason Dowling now from WAOW-TV in Wausau. Mason?
Hi, yes, thank you for taking this call. This is specifically to some of the wording in your order today, Governor, and I'm hoping you could shed some light on it. So using the example, it was brought up earlier, like a dog grooming, one of the common complaints you see people talking about on Facebook is like going to a hair salon or doing, the non-essential businesses. Would those, from what you specified, as long as it's done by one person, not done in the store, I guess, how would they be able to operate?
Sure, I can answer that question for the governor.
Sure, the question is.
So what this allows is it allows all businesses to be able to do a drop off of goods or animals. So as the governor mentioned in his opening remarks, gave some examples of the types of businesses that would impact, whether that was upholstery or dog grooming or small engine repair, other things like that. The reason why it doesn't cover some of the businesses you mentioned in your question is, especially with barbers or hairdressers, is there's prolonged contact between two individuals, and so it increases the risk quite dramatically. And as the governor mentioned, in terms of why we're turning the dial now, is because the the types of businesses and activities contained in this order are very low risk. There is very little person-to-person interaction, just in normal circumstances, and then with the additional safety requirements laid out in this order and previous orders, we're minimizing the risk even more. And that's just a type of interaction or risk that you can't mitigate when looking at, barbers or hair salons or other things like that, where you're in very close proximity, especially with the face, for prolonged periods of time.
Thank you, Mason. Now to Catherine Keller from the Bayview Compass. Catherine? Bayview Compass? Okay, we'll move on then to Addie Bink from WFRV in Green Bay. Addie?
Hi, thanks for taking my question. I'm sorry if this has been talked about before, but is there any plan to reopen those state parks that were closed earlier this month?
Something we always analyze on a daily basis. Certainly, we are very concerned when lots of social distancing was not happening, and also vandalism in the parks themselves. But we always analyze that, and we'll continue to analyze that. And if there's ways that we can make it happen again, we'll certainly consider it. But it was a wise decision at the time, but we also understand that circumstances may change so that we can reopen, but that hasn't happened yet, and we'll continue looking at the information that's available to us.
Thank you, Addie. Now to Megan Carpenter from Spectrum News 1. Megan?
Hi, can you hear me?
Yep.
Hi, can you hear me?
Yes.
Yep. Okay, thank you very much for taking my question. This is kind of going off of the last question as well. Obviously, as the weather gets warmer, people are going to be out and about much more frequently, possibly not abiding by the safer or the social distancing rules. Considering that the state parks have been closed because of that, is there anything else possibly that may be closed as the weather gets warmer and people start venturing out more and more frequently in bigger numbers?
Well, we certainly look at that data all the time, so you never say never, but I believe that people can do this in a reasonable place. And not all state park facilities have been closed. I mean, there's a good number that have not. Those that were closed were having specific problems, and it was disappointing for us to have to do that. But not all state parks or areas have been closed. But yes, the weather will challenge us. But people of Wisconsin know that they've saved lives by being safer at home, and they believe that social distancing and physical distancing is really important. And so I anticipate they'll find ways to make it happen in a really safe and fun way.
Thank you, Megan. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, this is Tim filling in for Sean. Governor, you said that the outbreak in Brown County shows the need for a statewide approach to reopening the economy, and reemphasize that certain parts of the state where cases have been less often do have less resources. We also seem to express some openness last week during a briefing with MMAC to potentially opening certain regions of the state before others if warranted. Is it accurate to say that you are potentially open to a regional approach if warranted, or is the focus completely on, is it completely a statewide approach?
This is exactly what I said a few minutes ago. But what we're seeing in Brown County and others in our state underscores the importance of taking a statewide approach to safer at home right now. That means that we're concerned about it, that these things are important, but, and I hear those concerns all the time. We will always keep an open mind to those issues, but right now means right now.
Thank you, Tim. Now to Tom from TMJ4 in Milwaukee. Tom?
Good afternoon, Good afternoon, Governor. A quick question here on businesses reopening. I know you've talked about some different ones opening today. You get a lot of questions about hair salons and restaurants. And I'm wondering if those businesses should be preparing for the future. Should they be looking at alternate ways to do their business? And if so, is there any guidance from the state or anybody that can work with them on those types of openings?
Sure. And there's organizations all across the state, from Wisconsin Manufacturers and Commerce to the Milwaukee Metropolitan Association of Commerce to our own WEDC, Economic Development Corporation, all have good ideas around social distancing, whether it's making sure that your shop floor is rearranged so that you're are socially or have the social distances for workers. There's all sorts of resources out there, not only on our website, but also those organizations all across the state. I mentioned a few in southern Wisconsin, but we have organizations that represent businesses all across the state. And also we have good examples of how it's working for those essential businesses, which frankly are many. We have many essential businesses in our state that have been open right from the beginning, and they've learned a lot, and they're more than willing to share their expertise with others.
Thank you, Tom. Now to Mark Halverson from WWIB Radio in Chippewa Falls. Mark?
Governor, I'm going to thank you for opening the golf courses. Got out there, and my son, actually 15 years old, he had his first time on the course yesterday, so thanks for that. But my question is pertaining to the state Supreme Court. I heard you say in a radio interview last week that you're confident that the High Court will rule in favor of your decisions and the way you handle this. Why do you have that confidence, considering the makeup of the court and the suit? Thank you.
Well, I believe we have the facts and and also the fact that we have the facts on our side, we have the law on our side, and we have lots of opportunities to share with the court where this type of action has taken place. So given that we have all those things on our side, I believe that our court will see the wisdom in our position.
Thank you, Mark, for that. And now to Cammie Rapson from WBAY-TV in Green Bay. Cammie?
Good afternoon. Brown County Health told us today that the DHS was part of a team that went through the meatpacking plants in Brown County on Wednesday, Thursday, and Friday of last week, and specifically said that JBS was working with the DHS. I'm wondering who went on the visit from the DHS, what did they report to you from those visits, and did it have any influence on JBS's decision to close on Sunday? Thank you.
I think they're talking about the CDC person, probably, right?
It could have been. We can get information precisely who it was and get back to you if you want to contact the media line.
Let us follow up with you. I think it probably was a person from CDC who we did request to come in and be part of the team working with Brown County, but let us confirm for you and get back to you.
Thank you, Cammie. Now to Tajma Hall from NBC 15 in Madison. Tajma?
Hello, thank you for taking my call. So regarding expanding testing capacity, I know that's been a big goal. And I know here in Madison, there's been talk of using the Alliant Energy Center for testing. So what's the timeline for meeting the goal for testing capacity and access?
So a couple things, right? We are at almost 11,000 tests a day. Our goal of 85,000 means about 12,000 tests a day. So from a capacity perspective, we have made significant and really important progress towards that goal. I think the second piece of that is utilizing the capacity we have and expanding the number of people who are being tested so that we are not just not that we just have the capacity, but that we are using it as we continue to drive beyond 85,000 tests, so that we're able to meet demand moving forward. And so we've made significant progress. We continue to work with partners to bring more labs online, to expand the capacity that we have, recognizing the supply chain issues that exist and the need to be as diverse in our lab capacity as possible to mitigate those issues as much as possible. But again, I think when we look around the state of Wisconsin at the rate at which people are being tested, we have a long way to go to increase the number of people who are being tested in every part of this state, so that we are actually able to get a handle on community spread and the prevalence of the disease, and surge those contact tracing resources to stop the spread. And so while our testing goal is not a gating criteria, it along with our contact tracing goal are critical pieces of infrastructure that will help us contain this disease as we continue to turn the dial and move forward towards phase 1 of Badger Bounce Back.
Thank you, Tajma. Now to Jason Kelvey from Fox 6 in Milwaukee. Jason?
Good afternoon. We've got so many questions on unemployment benefits, long delays and things like that. And one of the things I wanted to ask is, what's taken so long to get the federal money, the $600 extra money coming in for recipients of unemployment here in Wisconsin?
Well, certainly, as you know, we have successfully, every time I get this question, and this doesn't help the people that are struggling on it, but the number of people that we're successfully helping is far, far, far greater than the number of people that we are having difficulty. So we continue to hire additional staff and contracting out parts of the system so that we can do a better job making sure people get the responses they need as soon as possible.
Thank you, Jason. Now to Jessica Van Egren from Up North News. Jessica?
Hey, can you hear me?
Hey, yep. We can.
Okay, my question has to do with residents of Wisconsin group homes. DHS statistics on your site show that the number of cases at Wisconsin group homes has grown from 95 last Thursday to 189 as of today. Just wondering if you know why there is that increase, if it's due to the close proximity of folks living there or an increase in testing. Thanks.
I think it probably is an increase in testing. We have had a team in a group housing facility that has been experiencing an outbreak, so I suspect that it is related to some surge testing we have done related to a single outbreak.
Okay, thank you, Jessica. Now to Will Cushman from WisContext. Will?
Good afternoon. This question is for Secretary Designee Palm or Dr. Westergaard. I'm curious a little bit about some data that has had, I've noticed a downward trajectory over the last several weeks, and that is data related to location tracking. So the mobility of residents in the state. I've noticed based on that data that since the first week after the Safer at Home order, the number of people who have been staying home, according to this location tracking data, has steadily declined. So I'm curious about what your approach will be going forward as a Safer at Home order is extended through close to the end of May. How are you thinking about so-called quarantine fatigue and making sure that people kind of abide by this order and stay home whenever possible?
Mm-hmm. So I think, what we know about Safer at Home is that it's working. We are flattening the curve, and that people of this state have been unbelievably responsive and civic-minded about their role in keeping themselves safe and the broader community safe. And I, it's certainly not surprising that there's some fatigue around this. I'm tired of it. But I think, the vigilance that we continue to have around Safer at Home, and how that data is showing up to us either in the trajectory of positive tests as a portion of total tests, right? Well, that will show up in the data if people's vigilance is not enough to reduce infection and stop the spread. And so while we have seen really remarkable agreement and compliance with Safer at Home, it'll show up in the data if we're not doing it vigilantly enough. And so that is part of how we deal into the decision making that we're doing about turning the dial further, about the kinds of strategies, low-hanging fruit, places where we can continue to make progress, right? It's all a balance about how we're all continuing to do this together and how it works to stop the spread while we continue to put in place these containment measures of widespread testing and contact tracing that will be the tools we have when people start to interact on a more regular and more frequent basis than they are now. So we're watching all that stuff. It will show itself in the data if it truly does have an impact on infection rates, and we will balance that all together as we're continuing to move forward. I don't know if you want to say anything.
I think maybe one other message that we hope is helpful is sort of the idea that there's a light at the end of the tunnel. That right now our mitigation strategy, our stay-at-home order, really affects everybody in the community, and what we're building toward is a situation where we stop restricting everyone and we focus on just restricting the virus and the people that are infected. So we're using the phrase "box it in." Right now, the whole communities are getting boxed in. What we need to do in the next phase is specifically find people through testing, do the contact tracing, get those people isolated, get people who are exposed quarantined. And if we do that very, very well, and we start it at a point where we've diminished the number of people in the community to a manageable level, we can be really successful in the next phase, in the phase that comes after Safer at Home. But we're only going to get there if we really, really commit to getting the epidemic as small and as manageable as we can. And that's what we hope people can really feel some motivation. I was like, when we say we're in this together, like our strategy for staying back at work and not at home really depends on how well we do this. So really the next few weeks are going to be really critical for to make sure that we keep the epidemic small and hopefully make progress on those benchmarks.
Thank you, Will. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Hi. The question I have, I think, would be for the governor. But one senator said today in a statement that he fears that 750,000 jobs in the state could be at risk because if Safer at Home is extended. The governor said that 1 in 3 businesses, I think it's WEDC, I should say, said that 1 in 3 businesses are worried about closing. I want to know, do you think that's an accurate assessment about the 750,000, judging by the 1 in 3 businesses being worried about closing? Do you think that's a false equivalency? Where do you kind of stand on that?
I'm not sure I got the whole question, but yes, I know you referenced, one thing I did catch what you said, you referenced the University of Wisconsin Oshkosh study. And that's true, there are lots of people concerned about this, but we are headed in the right direction. We're getting the pieces in place, the tracing that Secretary Palm talked about, the testing that we're clearly doing more than ever before. And also making sure that we have the proper equipment. All those things are important so that we can not only bend the curve, but actually legitimately can see a trend line that is going down. And once that trend line goes down, we can take a look at how we're reopening the state of Wisconsin. Now, I have to tell you and reiterate something I said earlier, is that right from the beginning, the number of essential businesses in the state of Wisconsin is much larger than most other states in the country, or many other states in the country. And that decision was made because we felt some of those, all those businesses were essential to having Wisconsin thrive. So, but even some of those businesses, because of market forces, they aren't back to full capacity. So together, we're going to get through this, and I understand that there's concern by the businesses that answered that survey, but we're headed in the right direction, and I feel very confident that we will continue to dial it down, but we also have to recognize how important, even before I was talking about this the step we took today, we need to analyze that and see how it's working before we move to another dial down or to a new phase after the Safer at Home ends. So we're headed in the right direction, folks, and I'm confident that our business community is looking forward to those that aren't yet open, that they're looking forward to figuring out how their operations need to look different, and I know that's happening across the state. So it'll be slow, it'll be difficult, there'll be bumps up and down, and but at the end of the day, we'll be in a better place than we are today.
Thank you, Adam. Now to Ryan Curry from NBC 26 in Green Bay. Ryan? NBC 26? Okay, we're going to move on then to Lucas Johnson from WORT Radio in Madison. Lucas?
Hi, can you hear me?
Yes, we can.
Oh, sorry. This is actually Shelly filling in for Lucas. We've had some listener questions about ventilator allocation, and I know production has increased and we're only using about a fourth of the state capacity right now, but I'm wondering if you have any insight into how Wisconsin hospitals and health systems are setting priorities for allocating those ventilators to patients.
So I think there are a number of states who have looked at this issue, and this is certainly an ethics conversation that has been the subject of much academic discussion, and that hospitals at the local level are certainly looking at a variety of frameworks as they think about how they would make those kind of decisions. And so I think to your point, we have been very fortunate, and again, to the credit of the people of this state, we have not been in a situation where allocation was an issue, but obviously we have been in a situation as it relates to other necessary medical supplies like PPE, where we continue to struggle with those supplies and with ensuring that our frontline healthcare workers are protected and have what they need. We will continue to press FEMA and other parts of the supply chain to increase our access to necessary medical supplies, whether it's whether it turns out to be ventilators or whether it's PPE and medical supplies more broadly, testing supplies, reagents. Those things are all high priorities for us to ensure that we have all of the supplies that we need for our frontline healthcare workers and the patients that need to be served.
Okay, thank you. Now to Steve Prestegard of the Platteville Journal. Steve?
Good afternoon. Thanks for taking my call. I understand what you said earlier in response to a question about opening up to non-essential businesses.
And you've been listening to a press conference underway in Madison. Governor Evers outlining plans to open some non-essential businesses, allow them some expanded operations with some restrictions in place.